Congratulations on scheduling your Shockwave and Laser Therapies free trial. We are so excited to share our newest high-tech, powerful healing modalities with you. We are loving the radial pressure shockwave and deep tissue laser therapies, and we think you will too. I wanted to give you an idea of what to expect during your appointment for your Shockwave and Laser free trial at Hurley Chiropractic and Wellness. Please arrive 5 to 10 minutes before your appointment time to prepare for your session. We will briefly review your health history and discuss the chronic pain you have been experiencing. We advise focusing on one area of concern, and we can help you narrow down the most effective area to target. We will be using both the shockwave therapy and the deep tissue laser therapy on that same area. They are both very powerful tools and have a synergistic healing effect. They work even better together. The session will take approximately 15 minutes. Please arrive 5 to 10 minutes before your session is scheduled. Wear loose and comfortable clothing that allows direct access to the area we will be treating. Both therapies require contact with the skin. The shockwave uses a water-based gel to allow for sound wave conduction. We will have shorts and gowns available to change into when you arrive if needed. Now to answer the questions. What are these therapies and how do they work? The first is radial pressure wave, also known as shockwave therapy. Shockwave therapy's main role is to address chronic pain that has been ongoing or frequently recurring for at least 3 months. Maybe it started as an old injury that never fully recovered. Maybe there is scar tissue from a surgery. Or has it been constantly nagging you for 10, 15, or 20 years now? Shockwave uses intense sound waves to put stress on the damaged tissue. It is actually designed to create inflammation. I know this sounds like the opposite of a good thing. However, inflammation is actually the first step of the healing process. Shockwave's job is to bring that chronic issue back into the acute phase and trigger a new healing cycle. It's like telling the body, hey, you never finished healing this, let's try again. Due to this process, you may experience some soreness or notice increased inflammation for the first 48 hours. It should not cause severe pain, but it could be tender or feel a bit irritated. Try to refrain from interfering with this inflammatory process. After your shockwave session, please avoid applying ice to the area, taking NSAIDs, ibuprofen, or anti-inflammatory medications, and heavy weightlifting or intense exercise. Now, gentle to moderate workouts are just fine, and you should be able to perform all other daily activities. Shockwave does not require extended downtime or lengthy recovery, which is why it is a favorite of athletes for addressing injuries while training. During your session, you can expect the shockwave therapy to produce an uncomfortable sensation. There's no shocking or electric pain. To me, I describe it like a prickly type sensation. The goal is to tolerate a little discomfort, but not to endure pain. You are in control of the intensity at all times and should aim to keep the discomfort under a 5 out of 10 on the pain scale. The deep tissue laser therapy is our second therapy we'll be using. The laser can be used for nearly any type of musculoskeletal pain you can imagine, from headaches and TMJ pain to plantar fasciitis, arthritis, spinal degeneration, sciatica, and more. It pairs great with the shockwave therapy to address chronic pain and old injuries. The laser can also be used on its own immediately after an injury, an ankle sprain, a muscle strain, or even right after a surgery to speed healing. Laser therapy works by delivering specific wavelengths of light that penetrate deep into your tissues, up to 4 inches below the surface. This light energy is absorbed by tiny power plants in your cells called mitochondria. When they absorb the energy, they start producing ATP. That's cellular fuel. It can be up to 200% more than normal. Laser therapy gives your cells the energy they need to heal. During your laser therapy session, you should feel a warm and relaxing sensation. There should never be any discomfort. If it feels even a little bit hot, let us know right away. You may even feel pain relief by the end of your session. Laser therapy typically does not produce soreness, and you can expect to go about your usual routine immediately after a laser therapy session. Now let's talk about care plan recommendations. Every person is unique and every body responds differently. So the following are some general trends that can help provide expectations. Your chiropractor can tailor a care plan for you based on your history, your progress, and your goals. Many people experience some immediate improvement in their pain level and range of motion immediately after shockwave and laser therapy treatments. You may notice the muscles have loosened up or less stiffness in the joint. Both therapies also have an immediate effect on the nerves, which can provide for up to 18 hours of relief after the session. Now, the magic of these modalities, or the statistical evidence, shows best results with consistent weekly treatments. The amount of treatments required will depend on your unique needs. If your pain is mild and maybe just started a few months ago, not bothering you too frequently, then you may find 3 to 6 treatments to work well. If your pain is above a 5 out of 10 and has been going on at least a year, expect 8 to 10 treatments. In general, we see that the more chronic the pain, the more treatments the body needs for long-lasting results. Now, the coolest part about both the shockwave and the laser, it's not just the pain relief in the first few weeks of treatment that's the goal. Each treatment is stimulating cellular healing. The goal here is not just reducing pain or inflammation in the short term. Over time, the tissue is getting healthier and stronger. In fact, my deciding factor in choosing to bring both of these technologies to Hurley Chiropractic and Wellness was in seeing the statistics on using both the shockwave and the laser together. The study reported that many patients continue to improve weeks and even months after their round of treatments had ended. I wanted to offer hope for long-term healing to our patients with chronic pain. We are so excited to share this with you.